Throughout my journey in becoming a nurse, I have started to develop my own personal philosophy of what nursing is. My philosophy views nursing as a way of healing others. First and foremost, my philosophy views nursing as both an art and a science. To me, the art of nursing means involving not just the patient but their family as well. It's about knowing how to connect with those around us through caring and compassion in order to create an environment of healing for our patients. Nursing is also a science. Of course, as nurses, we are taught the theories and the scientific knowledge in order to understand a patient's disease process, medication use, and aids us in individualized nursing care. As I reflect back on all the experiences I have had in clinical practice, I am reminded of the essence of the four meta-paradigm concepts of nurse, person, environment, and health. There is so much I've already encountered as a nursing student and still have a lot to learn, but one thing that has always stayed with me is my ability to heal. You may wonder, how does someone like me heal others when that should be the physician's job? Well, to start, my philosophy of nursing views the person as a whole. Healing others requires the nurse to look at the person holistically through mind, body, and soul, looking at different aspects of their needs. Here's an example. I once had a patient, Miss D, a charming 52-year-old woman, admitted for hypoglycemia leading to altered level of consciousness, and had other healthcare issues, one being chronic pain in her right foot due to cellulitis. Every day, Miss D was visited by her two sisters and daughter who assisted in her care. She was required to take IV antibiotics once a day and insulin 3 times a day. And because Miss D was in a lot of pain, she was required to use a walker to assist in walking. All these different aspects of the patient is what defines the person as a whole. Nursing as a way of healing is to view them greater than the sum of their parts. The meta-paradigm concept of environment also plays a crucial role in healing. My philosophy of nursing does not limit the concept of environment to just external factors, but rather internal and social factors as well. Miss D struggled to pay her rent every month, impeding her ability to afford the proper healthcare treatment at home. On the brighter note, it was important for her to be in an environment that included her social support network to assist in the decision-making process of her healthcare. My philosophy of nursing sees the importance of the patient being in an environment that is conducive to his or her recovery. My philosophy of nursing views health as a dynamic process. In order to heal, we must recognize health as one's lived experience. Miss D experiences different circumstances that could interfere in her road to recovery. Mrs. D's chronic pain becomes a threat to wellness, but one way of helping her feel healthy is her ability to use her walker, as this facilitates independence. My philosophy views nursing as a way of healing through trust and empathy, and a commitment to the patient's lived experience of human health. As nurses, we heal by using therapeutic touch, active listening, being present in the moment, and instilling hope. This is the art of such a fulfilling profession. I was able to gain Miss D's trust, which facilitated the healing process. Working alongside the art of nursing, nursing science in itself still guides and advances our nursing practice. With Miss D, I continue to use my technical skills, such as executing a sterile dressing change and inserting an IV. My philosophy looks at all the meta-paradigm concepts and considers each one in the provision of care for my patients. My philosophy of nursing is valuing the power of healing by fostering a supportive environment, emphasizing the person's well-being, and empowering the person to manage his or her own health through their pathway to wellness. As I continue my journey in becoming a nurse, I will continue to learn new knowledge and grow from my experiences in order to heal the grief and suffering, and also instill hope and promote well-being. These values and beliefs are what build on my personal philosophy of nursing.